Hello, namaste.
Eh?
Namaste, one and all. It's been an honor and privilege to be part of this webinar in which most of the stalwarts have also I have seen number of the participants, many of the famous practitioners also have joined in this webinar. We are glad and happy that our Dr. JAYAKRISHNAN sir have agreed for a webinar to join with Vishwa Ayurveda Parishad in Vaidya Kaushalam seminar, a webinar series. Vishwa Ayurveda Kerala is actively working in all fields of Ayurveda possible, however, to increase the confidence and practice-oriented aspects and practical approach of Ayurveda towards the students. So Vishwa Ayurveda Parishad is continuously doing webinar series, medical camps, seminars and all. We are continuously doing Suputrium project and all in Kerala, especially for Garbha Samskara purpose and all. Nowadays, we know that the confidence of Ayurveda Vaidyas and Ayurveda students return practice have become less comparatively to the previous era. And one of the practitioners who successful practitioners, Dr. Vedatin sir, is here to guide us with the basics principles of practicing during especially during the seasonal regions of summer times and its diseases. So before starting this webinar, I would like to invite our Dr. Surendra Chaudhary ji, our National Secretary of Vishwa Ayurveda Parishad Kerala from New Delhi, to make a brief introduction about Vishwa Ayurveda Parishad national level activities and our further activities in the field of Ayurveda. We welcome Surendra Chaudhary ji, National Secretary of Vishwa Ayurveda Parishad.
Namaskar. Thank you, Adarshji, for inviting me and providing me this wonderful opportunity to share something about Vishwa Ayurveda Parishad. So first of all, please accept my greetings on the auspicious day of Holika Dahan, which is being celebrated in entire northern India with much fun and fair. So please accept my heartiest congratulations and best wishes on this festival. And secondly, I would like to thank the Kerala unit who organizing this wonderful webinar under the proposed for the physicians particularly, because this is the right time to have alignment from the stalwart like Dr. JAYAKRISHNAN ji, who has almost 40 years or 37 years of experience delivering the health services to the nation. So let us start with a brief introduction, because I don't want to take much time in between the audience and our great speaker. Vishwa Ayurveda Parishad was established in 1997 with the theme of establishing its past glory, because the Sangh Pracharak, who was handling over for the Daitva of Videsh Vibhag, so whenever he visited abroad, so always everyone was asking about the status of Ayurveda. But unfortunate part was that in India, there was no discussion, there was no status of Ayurveda. So they decided to start Vishwa Ayurveda Parishad to establish Ayurveda to its past glory. And since last 26 years, we just celebrated our 25th anniversary in 2023. We are working very hard, and we can say that Vishwa Ayurveda Parishad is the largest organization in the field of Ayurveda. No other national level organization has such a vast presence in different states. We are working actively in 22 Indian states with over 10,000 life members. And we are working in every field of Ayurveda, means whether it is a student, the faculty, the farmers, the physicians, or even the society also. We have tailor-made programs for all these stakeholders. If we start with the students, all over India, we are conducting 3 good essay competitions, 2 essay competitions for graduate level students, 1 for postgraduate students, And one more started in the loving memory of our renowned physician, Professor P.B. Venkatacharya ji, the best thesis award for all the MD scholars. Secondly, we are conducting one more important thing for the budding students who want to join their post graduations, the pre-PG mock test in the name of Lakshya. Likewise, Vishwa Ayurveda Parishad regularly conducting the skill-oriented programs just to enhance the skill of our stakeholders, whether they are students, the faculty, or the physicians. One more important in the flagship program of Vishwa Ayurveda Parishad is in the form of a Kausalam. Right here, like today, we are conducting this program under the Vedya Kausalam also. So we are conducting regular programs having 3 days to 7 days residential programs for faculty, students, and other stakeholders of Ayurveda. So, in nutshell, we are everywhere and in every field for everyone. The only and only the sole motto is just to enhance the skill, enhance the capacity, building the capacity building of our stakeholders, and just to have some insight of what Ayurveda can do for the general public as well as our stakeholders. So, being in brief, it's all about Vishwa Ayurveda Parishad, and I will invite all the participants just to join us, because the live membership is now very easy and it is 100% online. You just have to go to the vishwaayurveda.org or just Google the Vishwa Ayurveda Parishad. You will get our homepage, and there is a link on the middle of the homepage. Join us today or become a member. And we just have 1100 rupees lifetime membership fees, which is nothing as per the inflation of this type of things. So I again thanks to the organizer providing me this opportunity to introduce Vishwa Ayurveda Parishad in a brief note, and I will be happy to have this stalwart in the form of Dr. JAYAKRISHNan, and I'm really excited to hear his version and his knowledge and his wisdom. And thank you very much for inviting me.
Thank you, Dr. Adarshi and Surendra Chaudhary, sir. So let's move to the webinar series, today's session. So it's my privilege and honor to welcome Dr. JAYAKRISHNAN KT, Medical Director and Chief Physician of Triyog Ayurveda Hospital, Chennai. Sir is a renowned physician and academician with more than 37 years of experience. And he is the former physician, professor, and medical superintendent of Ayurveda College, Coimbatore, and former professor and principal of Sri Jayendra Saraswati Ayurveda College, Chennai. And I wholeheartedly welcome you, sir, to share your knowledge with us. Welcome you, sir.
Thank you. Welcome. Can I start?
Sir, you can start, sir.
Yeah, it's clearly audible, no?
Yes.
Yes, sir, it's audible.
Yeah. So, Guru Bhyo Namaha. So, first, let me thank you for having invited me to present my understanding on Ayurveda, especially to the practicing doctor, physicians, and students who have an earnest interest in understanding Ayurveda and practice accordingly to the benefit of the public at large. Being an academician, basically, teacher for a very long time, and majority of my work has been confined to the college hospital. That is how I could be able to develop the practice, patient relation oriented things. Of course, it's purely based on the Shastra understanding. I thought I should be able to convey this pure Ayurvedic understanding to the community, as Chaudhary Sahab told, to the stakeholders of Ayurveda, where I think it is high time that we need to find out the glory of Ayurveda, essence of Ayurveda, Ayurveda as it is. And it is not against any other science also. To your interest, I would like to say that I was an anatomy teacher for a very long time, along with the other activities. So this is not against any other modern science. I always used to say that we have a big confidence in talking the scientific mode. That much confidence we may be lacking when we talk in Ayurvedic. So I think I'm sure that we also can develop a good understanding in Ayurveda. When you become very clear, when there is a clarity in Ayurvedic theories, you will be very confident and you need not feel ashamed to stand straight in front of anybody at the contemporary field. So that is what I've been preaching, practicing, and explaining through different seminars and all to the Ayurvedic fraternity. So this time, I also was, I think, influenced by the social medias, like YouTube and Facebook kind of things, where I also came across with a lot of diseases happening in the summer, where Ayurvedic people are not able to give a confident reply to whoever is questioning the capacity of Ayurveda. So that was going through my mind, and I happened to be invited to this program where I said, we can stand straight and say, this is what we understand about the summer. This is where we look into the body, and accordingly we change things based on the climatic impact on the body. So to have an understanding of what summer, Grishma is, we must have a very clear understanding of what the body is according to Ayurveda. We all know that, first sloka of Ashtanga itself says, Tishnam Shiradi Tishnam Shir, Grishme Samshit Tada Iva. Pratyaham Shriyade Sleshma. Pratyaham Shriyade Sleshma. The Sleshma is going down every day because of the intense heat of summer. And naturally, other words we say, Vayureva, Vayushchavardhate. When Sleshma is going down, in other words we say Vayusing. Both are not different, both are simultaneous. And from this, what we can understand is that your body is getting dry. So we say the snigdha nature of Kaba is reduced. Or in other words, the Ruksha nature in the body is coming. That shows that the body is Kaba dominant. Normal, healthy body is Kaba dominant. Properties of Kaba basically are Snigdha and Shila. This property is coming from Prithvi and Jala. So what you understand from Shastra, body is just Prithvi and Jala, not only body, the entire world. Gross world is dominated with Prithvi and Jala. Prithvi and Jala presents you the optimum level of Snigdha nature, where you cannot say you are dry. There is no Ruksha felt normally. So your structure is Snigdha, optimum Snigdha and minimum Shida nature. This is getting affected in the Grishma ऋतु. That means your structure of health is being eroded, going down because of the intense heat being produced in the summer. We know that the seasons are also divided into 6. Shirodha Vasantashta, Grishma Varshta, Sarat, Himant. These 6 seasons actually indicate that how every being in the universe is subjected to natural disintegration. Your body is also subject to disintegration naturally, even without a disease. Like that, everything in the universe is subjected to natural disintegration. Where the changes of these can be ascertained through what we call the season. In a typical place like Sadharana Desha, I always used to say Kerala, you have a Sadharana Desha climate, and 6 seasons can be easily felt in Kerala. That too in middle part of Kerala, not everywhere, middle part of Kerala. So these 6 seasons, starting from Shishira, actually indicate how a normal structure can be disintegrated. Normal structure is, as I told you, Kaba, Snigdha Shida, which can be vitiated with the Ushna. When Ushna is induced, it becomes Snigdha Ushna. Result is that the Snigdha is gradually dissolved and structure becomes Ruchaina. Then subsequently it gets damaged. This is happening to everything in the world, including your body. That's why 6 rasas, 6 radus, which typically explains what is happening around you. So just like we say, body is annat bhutani jayante. Body is what you eat. Then through food, we know that 6 rasas, things are supplemented, changing into normalcy, normal transformation, growth, everything is happening. Food, Shadrasa is further divided into Maduram, Amlam, and Kadu, which explains what I explained just now. Madura is Snigdha Shida, that is the normalcy, health, Prajanmya Satmyan Maduram. That is the best thing for the body, provided it is the proper level. That becomes, Snigdha Shida becomes Snigdha Ushna when it turns into Amla, where the disease process can start or damage to the structure of the body can start with this Amla turning, Snigdha turning. Then, as a result, the Snigdha will be dissolved. We say Abhishyandam. The Snigdha structure will be flowing out, and the structure, what is remaining there, becomes gradually rooted down. And then Shida will not be there. We say Ruchoshna. This is the nature of Kaduras. So that's why we say Trada Vibhago Drivyasa. Everything, Drivyam throughout the world, this is the way everything is. This is the way in disease also changes are brought about by unwanted practices. Okay, so that is one thing I wanted to say. I want to say that normal structural body is Kaba dominant, in which you are getting a damage in disease process. So if you know what is happening in the body, then only you can think of how to reverse it, how to correct it through your food, activities, or any other adjustment. So whenever we try to understand what is happening in the body, especially in a disease, the first thing is an understanding of dosha or dusha, which is getting vitiated through dosha. So both are, we know that all dhadus, 7 dhadus are structurally dominant with kapha because it is Sthula. Sthula nature lies only with kapha. In Rakta, we have a trend towards Pitta nature. So we say Pitta is closer to Rakta. Asti, the structure is kapha because it is having a drying process inside. And drying process is there everywhere, but it is very strong in Asti. We say Astini Sthito Vayu. In Asti there is one, but Asti is kapha. So all the dhadus are kapha dominant, structure is kapha, body is kapha, in which the pitta related Ushna is responsible for creating the normal digestion, normal assimilation, and subsequent normal supply, normal degeneration also. And to check the Kapha and Pitta nature, Snigdha nature, you need the Rudra nature, other side, which is Vayu, and that is facilitating the movements in the body. And the food is just traveling through the costa, which is 6 meters long, and it is absorbed and is taken to different parts of the body, which is a movement. Growth is an expansive movement. Transformation of Dhatu is a movement from one form to another. So there also Vayu is important. So 3 doshas are understood in terms of the gunas reflected by them. So dosham or dushyam, to understand while treating or understanding a disease. Next is desham. Next, what you are looking for is desham. Dushyam, desham, balam, kalam. Desham and kalam. Desham is the place where you have been familiar, you have been living, and it is also identified by the same gunas. Like we say, Snigdha, Ushna, Duksha, Shida, nature, which represent the 4 Buddhas. Same can be felt from the desha. So if you are staying in a place like Chennai or a desert like Rajasthan, we say Ushara Bhumi, Ushara Pitam. Comparatively, the impact of Ushna and subsequent Usha nature will be more in the body. So while doing treatment or giving medicines or understanding the disease impact, everywhere you need to calculate the impact of the place where you live. Then only you will be effectively good. You understand that body is not stagnated. Body is changing every second. Disease is also a process of which changes every second. It's continuously changing because disease happens in dhadus. Dhadus are always changing. So disease also never stays there. It is changing. So then and there, Sushma Samishesha Dosha Ushada Nirupana. When you think of medicine being administered, first thing you are looking for is Dushyam, Desham, Balam, Kalam. Desham has to be calculated to create a knowledgeable result in treating a disease. Same is the importance with after Balam. You say Balam is very weak. No disease can be cured. Even a cold will not be cured. This is not like a modern science. We don't talk about a disease alone. In which body you are getting a disease. A person getting a disease at the age of 90, it will be a little difficult. A person getting same disease at the age of 5, it will be easily responding to a treatment. Sarva Ushadakshame Deha, Yunaha. That is why Sugasati. So many ways we have independent, different understanding of dealing with a disease. That should be understood in its own terms, so that you will be doing a work. It's not medicine. We all understand that Prayoga Samed Vyadin is not Dravyam Samed Vyadin. Application of medicine is working. We know our medicines are very ordinary. Rasa dominant, you say food. Virya dominant, we say it is medicine. Ushadam Virya. Ginger used in kitchen is a food item. Same ginger effectively used in a right context of Jwara. In a particular context of Jwara is a wonderful medicine. So what makes a difference is that contextual understanding or your knowledge about what is disease, what is body, what you are doing there. So that knowledge, intellectual knowledge makes a difference and makes the disease reduced effectively. So you are creating a result. That's why Ashtangarjan says, Prayoga Samedya. Using Dritya, using your activity, using many other things concerned with Desham and Kala. That is how you effectively deal with the diseases I don't want to specifically mention disease. In that context only, we must look at summer, Grishma, and moreover, now everybody knows the climates have been changing. Last few years, I think drastically changing. So, an effective physician also should be able to comprehend the changes happening surrounding you. So, in Kerala and all nowadays, I think summer like heat started coming. Actually, Grishma has not started. Now it is Vasanta Ritu actually, where daytime you will be having heat and nighttime it will be a pleasantly cold. It's not very cold, pleasant cold. So what happens in Grishma or even in Vasanta, you must be very clear that the Snigdha nature of Kapha accumulated in Shishiram or even Hemantam, Shidakala. Shishiram Hemantam, you have same way of dealing with the body. So Shidakala, you accumulate, you get extra appetite because of the cold nature. You eat well, and the Snigdha nature will be well dominant in the body. That Snigdha will be destabilized in Vasanta because Ushna nature is there in the daytime. With the Ushna, the Snigdha will be melting. Just like the ghee getting melted, coconut oil getting melted, the Snigdha nature of the body is subjected to, we say, Abhishyanta or Ulklesham, we can. It will be there. So, Kapha related diseases will be more in Vasanta Ritu. So, Kapha treatment is naturally told, Vamanam, Nasyam, all those things. And whatever you take should be addressing Kapha. Kapha increasing things cannot be taken. Kapha vitiating things cannot be taken. Typical thing is curd. Nevadya Nevoshnam, Vasandoshna Sharat Sudnacha. Vasanta, Ushna, Sharat. You are not supposed to take curd, where Snigdha and Ushna are down. So it will be just creating a destabilizing the dhadus in the body. Then you are vulnerable to any disease. So when naturally body is destabilized in Vasanta Ritu, then you are entering Grishma Ritu, where extreme heat is the main nature. Ushna feeling is the main nature, not only in the day, even in the night. You feel the effect of heat in the body, and the Snigdha nature is completely getting dried up. So we say body gets a Rutra, starting, beginning of the Rutra nature, and we say the Vada is subjected to Chayam. Kapha is subjected to Chayam. And Ushna is prominent. How you address these atmosphere in a disease, any disease. Nowadays, I happen to hear that Kerala, that hepatitis or leptospirosis kind of things are spreading. So, any disease need not be confined to one disease, depends upon the individual getting any disease. It can have a flare up because body is getting weaker. Disease becomes prominent. Our concern is how to address, how to calculate the impact of the climate into the disease. So when we understand what is a body in which the disease is happening, and you are using medicines which are completely confined to the Snigdha, Rutra, Ushna, Shida nature. We know that before Yatta Moksha, Bhagavad says, when your treatment like Snehanam, Rutranam, Shida Kriya, Ushna Kriya all fail, to understand that the Dushti is in Rakta, then go for Yatta Moksha. It implies that whatever you are doing on the body comes under this 4 categories. Snehanam is almost like Brahmanam, Rushanam is Langanam. Then you have Swedanam and Stampanam. Swedanam is Ushna treatment, Stampanam is Hida. You are addressing 4 Bodhas, not exactly Akasha Bodha, other 4 Bodhas which has got physical existence. So these Bodhas are addressed and adjusted to see that the inner balance is created in the body. So whatever you're doing with medicine, aharam, viharam, as well as many other factors, extrinsic factors like seasons or age, where you are calculating the Kapha, Pitta, Vata, where you see only the Snigdha, Ruksha, Chida, and Ushna things. So Dravya is also identified in terms of Tridosha, means in terms of its property. So while inducing the Dravya or a medicine, your basic calculation is what is a body, what is this particular body, and where he is staying. Then the third thing is which climate you are giving. I can give you a best example. See, Vada treatment, which is very familiar everywhere in India, with the Sneha Sweda. You do a lot of Patrapola Sweda, Pinda Svedam, Shashtika Pinda Svedam, lot of things. Sneha Svedam is considered to be the treatment for Vada, or in any treatment, there is internal weakness. We carry on with this kind of Sneha Sweda together. That practice is there and it is effective also. The issue is that with which oil you are doing Snehana and Sweda. So based on the different, climatic conditions in India, you need a lot of oils with the different grades of Ushna and Snigdha. When you do Sneha Sweda, you mean Snigdha and Ushna is being infused through the process. How much you need to understand from the body of the individual, then the climate, the age, the place where he lives, based on such things, and the dosha domination, the disease in which you are doing it. For example, Prameha Roga is getting a back pain, Vadavya. So you need to do Sneha Sweda. Prameha Roga, Swedanam is contraindicated. Reason everybody knows. You just forget about diabetes for the time being. Prameham is Kapha Sapittam. Sapittam Kapha. Pitta background is there, Ushna background is there, and Kapha is vitiated to create weakness in all dhatu, that is known as Prameha. When you do Snehanam and Swedanam, Swedanam is induction of Ushna further. That's why it is contraindicated in Prameha or Pandu, any condition. But Vadavyadhi is acute condition, you need to deal with that. Then you ensure that you don't use too much of Ushna. Especially in a climate like the Grishma, summer is coming, Vadavyadhi is there, back pain is there. Then when you induce Ushna thing, you ensure that minimum Ushna Dravyas are used. So minimum Ushna Dravyas has to be understood, or whatever medicine you give, you ensure that you are not having Ushna Dravyas too much. What I used to do is, if I am using Dhanvantaram Kashayam, I used to add Drakshadi Kashayam to it, to see that the Ushna nature of Dhanvantaram is not disturbing the patient. Same way, even though you are doing external application, you have, I think to my understanding, 25 to 50 oils are available in the market. All are good for all Vadavyadhi. That is how book will say. Vada Vikaranam Satam Chanivartati. All Vadavyadhis will go with all. In a different way, you can't express that. It's good for Vada, provided you understand that. Ushna Snigdha will be there, but you need innumerable grades of Ushna and Snigdha, because body of individuals are different, climate is different, age is different, then dosha domination in the background is different. So you cannot casually say this oil can be used, that can be used, because book says. then your intellect is not working, no? Book can generally give you idea of how to use Ushna and Sita. Padasya Upakrama Snehasveda. Samshodhanam. Snehanam and Sveda. Sita and Ushna things you need to induce carefully. Sushma Samishesha. Then only you can induce it. So a medicine can be induced where the Ushna can be addressed with making combinations. Oil can be selected by using, for example, see the famous Kotanjukal Thailam is very Ushna prone, widely used in Kerala. But it may not be very good in a Ushna place like Rajasthan or Delhi. You can't use it. It may not be effective. You use it, it may not be effective. It will not create a trouble like an allopathic medicine. Instantly, it may not create a trouble. But we must understand, you don't require that much Ushna. That's why other oils like Narayana Thailam is very famous in North India because it contains a lot of milk. Milk is added to other Haradrivyas so that the Ushna nature is minimized. Snigdha is supported. Dhanvantari Thailam, Sajara Thailam, you see Dhanvantari Thailam has got 4 times of oil, 4 times of milk added to it. You understand? And it is good for all Garbhini, Charyas, uterine complaints where Rakta is directly involved. Dhanvantari Abhimadam, Yoni Yoga Chayapa. Sajara Thailam, equal milk is added. Still the Ushna is addressed. So some general specifications have been given. You understand the implications. Make things according to your requirement. Book cannot say the innumerable variety of oils. That's why in the market you have 25 to 50 Vatahara oils being utilized by different physicians. Knowingly or unknowingly, people. Some oils are famous in some parts of the state, you know. Like Murivanna, you have 20 varieties actually in Kerala. Nagarkovil and all, you have Paliyakaya Tirumeni oil for the injuries, Marmapika. Like that, different places you get a different oil based on the calculation of the place where you live. That's very important because we are exposed to the impact of sun, moon, and air. Basically, this is what is Ushna, Sida, and Ut. So we are also exposed to that. Even if you are sitting inside the room, external climate is having an impact on it. So Dushyam, Desham, Kalam, Kalam. Kalam, you need to season, you need to understand. So in summer, you get a cough. We all know Kasa. Kasam is generally Vata Kapha in nature. Kapha is accumulated in Kapha Sthana, so that the Vayu movement is disturbed. Body is trying to push it out. So Vata is there, Kapha is there. So generally we give medicines which contains Trigadu combination, wherever it is, to see that the Kapha is dissolved. Trigadu is Ushna Drivya. So we give it and the Kapha is dissolved, or you can move. In general. Suppose you get a strong cough in summer, Grishma. Are you supposed to give the Trigadu, or that is only option you are having? Like Talisapatradi Churnam, Karpuradi Churnam, or Sidhobaladi Churnam, Ashmula Kadatrayam, or Vashavaleka, Magasther Rasayana, Tambul Leshim. To have all medicines in which Trigadu is a main ingredient. Why do you get so many medicines? So the Kasa can be in general Vata Kapha. When you specifically, it can be Vata dominant, Kapha less. Kapha dominant, Vata less. Which is Kapha dominant, you need to understand that Kapha can be vitiated like Vasanta Ritu. With the Pitta background also, Kapha can be vitiated, where you cannot give Trigadu. Trigadu cannot be used. This is very clearly told in the book. If you go through seriously in between the lines, you understand that there is a kasa known as Tamaka Kasa, expertly explained. Tamaka Kapakase Tusyate Pittanubandhaja. Tasya Pitta Hari Kriya. Such cases you need to use Pitta Hari Kriya, Hida Kriya. Even if it is Kasa, Pragodu is not indicated. This is what I say. The impact of Pitta either in the body or in the disease or even in the climate, we need to look into and use medicines accordingly. You know that Talisapatra contains Kanashta Guna Sarkara. Trigodu kind of medicine, Talisapatra medicine, Nagaram, Bipri Chupa, Edotra Bhagavrata, Togela Charda Bhagi, all Trigodu kind of things. Plus Kanashta Guna Sarkara. 8 times sugar is added to that, so that the Snigdha nature of the body is preserved. While you are inducing Trigadu, you are preserving the Snigdha nature of body by putting this much of sugar. Sarkara. Or Sidopalal Churnam, we are using Kalkar. Sugar candy. Where the impact of Trigadu will be further reduced. You understand? So we are already doing it. We need to look into it in a deeper meaning. What has happened to the body? First, we must have an understanding of body in our own way. This is what is missing in our field, to my understanding. Because once we understand anatomy and physiology, we think we know the body. And in that understanding only we look at the disease. So we'll be knowing only cough or bronchial asthma and all. We will not be able to discriminate different types of cough. So naturally we go at fault by inducing the medicine. It may not be completely effective. At the same time, you don't feel that you have created a result knowingly. You also will not feel satisfied with that. You give a medicine, sometimes cough disappears by you wonder why it has happened. When you know that this is the body, this is the disease, this is the medicine I am giving, it becomes a knowledgeable exercise and you feel satisfied. Disease is cured. So any disease condition, we must be careful to see that we know it before we start doing the treatment. We understood the condition. Yada dushtena doshena yada chana vicharpada. This is sampradaya. Even if it is a wrong understanding, you try to make an understanding that this is what has happened to the body. It is possible. Based on that understanding, look to the medicine. Jwara, especially this is leptospirosis or even rat fever is very common nowadays. Dengue is also common. You know that more major fevers even now in the world include dengue, cholera, typhoid and malaria. These are the major fevers even now in the world. Because when you start with allopathic antibiotics and all, the basic health is not there. It further creates a lot of heat in the body and the patient goes down. We also do the same mistake, whatever is fit for fever. Lot of things like Viagradi, Patyadi, Kashayam and all, or Amrudharishtam, Gorojanadi, Suvarnamuktadi. Lot of medicines we give, majority of them are addressing Vata Kabajara. That will not be good for the kind of fever, especially typhoid or leptospirosis. To understand, leptospirosis, when it is cured, it leaves either kidney or liver damage. So that kind of damage, from where it has to happen? When you damage a structure, without Ushna, it cannot happen. Ushna nature, Amla nature, acidic mode, like acid damages. We also say the Amla nature can damage. In Amla, Ushna is a major thing. Ushna can damage. It can degenerate the stomach. So Jwara is a condition in which there is a lot of heat in the stomach. That Ushna, when you are addressing, you ensure that Kapha or Vata is not disturbed. Ushna has to be addressed. Then Pitta dominant conditions are there, like Pitta dominant Sannivadam and all, you need to visualize in type 5. Pitta is to be addressed. You cannot give Ushna dominant medicine. There you need medicines like Drakshadi Kashayam or Guluchari Kashayam or Shadangam Kashayam, in which Pitta is addressed. It is provoking Vata or Kapha. Some medicines have to be added to that. So naturally it becomes a work you are going to do. Don't expect that I gave the medicine, my work is over. Unlike allopathy, whoever gives paracetamol, fever will come down. For us, it is not like that. You are doing a work using a Drakshadi Kashayam. Suppose because of the Siddha nature, Vayu is coming up, body pain is coming up, cough is coming up. You need to add some Dhanvantaram Guliga or Villuvadi Guliga, some other Guliga to it, so that instantly the Vata impact is addressed. So you are able to work on that body. Consider that you are doing a work using medicine. Same is important of food, which cannot provoke a dosha. Same dosha balance can be disturbed by the food you are taking. That's why we say patya. And activities you can have. Activities also can. Vihara. Activities also can have an impact on the dusha and desha, the dusha and dhatu contact. So when you do things knowingly, you can create a result in many conditions. You also feel confident and satisfied. You can stand up and say that even acute conditions you can deal. Otherwise, what happens in our field is that when we are not confident in our own Shastra, or rather we are more confident in the modern science. An acute condition comes, you are supposed to do the Ayurveda treatment, Ayurveda medicine, where you are clear is Western science. What you are supposed to do is Indian Shastra. So there is a lack of clarity, or less clarity. I don't say no clarity at all, less clarity. We know that tamasam bhayam ajnanam. Ajnanam, ignorance. If you are not very clear of what has happened in the body, it induces fear, bhayam. So panic will be there inside. What to do? You get a chest pain, whether it could be heart attack, can be due to hundreds of reasons, but we will be thinking of heart attack first. And we know everything about heart. We don't know actually Hridroga. What to do in Hridroga? Why there is Hridroga? We are not confident. We are not clear in it. See, when the Sutasana says what is absolute health, swastha. Prasanna alpendriya manaha swasthaita vidya. Prasanna means clear. So in mind, what is a clear clarity? It is a clarity of thought. Whatever subject you are dealing, there should be a clarity of understanding. That should be understood very clearly. That is the healthy status of mind. Whatever subject, need not be Ayurveda, whatever you read, you need to look back and see whether I understood it or not for others. If your own satisfaction, you can look back and see whether I understood the situation or not. If I don't understand, I am at loss. That's all. Then I will, when I understand that I have not clearly understood this, then only I will try to better my knowledge. Like Einstein says, that I don't know is the biggest knowledge in the world. Einstein says very clearly, when you understand that I don't know it, that is a bigger knowledge. Then only you will try to improve, improvise your understanding. for which discussion Tadvidyat Sambhasha is a great mode of enriching your knowledge. Everything is there in the book. We all know that. So whenever a disease comes, in summer or any season, summer you understand, body goes weak, you are supposed to have any disease. Not one or two. You can be inflicted with any disease because body goes naturally weak. So Grishma Charya says how you support the body. You cannot have kadu, amla, lot of amla things, lot of kadu things, lot of activities, even vyayama you are supposed to stop. You cannot exhaust your snigdha content in the body. At the same time, you are supposed to take a lot of lagu, snigdha things. Snigdha should be there, but it cannot be guru. It should be lagu, like laja and all says. A lot of liquids, juice kind of thing, for your water. Snigdha content is maintained in the body. So suppose you have a lot of kasa. How can you take a lot of juice? You cannot take a lot of juice. Ginger water is there, chukkuvala, what you say. Ginger water is actually indicated, little ginger, little jeera, kind of thing. But water will be going inside, it will not create chidani. And ginger is there or jeera is put in that. You are just protecting that vata atmosphere in the body, are not provoking kava in the kasa. So knowingly we are doing. This is what I say. You are prone to any disease in Grishma since your body is Shiyade Seshma. Then you understand that body is Leshma. Structure is weakened. This is where you are having a different understanding of your body, patient's body. And then you are reacting to the condition then and there. Then and there, what is happening? When you Sushma Samishesha, closely you are watching what is happening to the Kapha Pitta Vata, impact of age, impact of climate on this body, impact of the place on this dosha. So when you closely watch, suppose summer there is a sudden rain coming up, what happens? That body gets suddenly cooled, already body is dried, when suddenly cooling nature, Chuksha nature, you get suddenly a Sida nature of Jala. This is what happens in Varsha. Say Vata is getting prone. Vata is subject to Koba in Varsha. Grishma it is subject to Chaya. Suddenly Sida nature is coming. Vata conditions can come up. One more thing we must be closely observing is that the habit of the change of food style in the public. You know that nowadays, olden days and all, when I was a young student and all, basically our food was, what is a paya, with enough vegetables, whatever is available around your habitat, that be utilized in different ways, but basically it is paya. Now we know that we have access to different kind of food. Food habits have been changed, and Amlam and Kadu makes you more tastier. You know that entire spicy things actually go to the different parts of the world from Asia, especially India. India supplies all kind of spicy things to the world. India, it is getting naturally adjusted. In fact, the spices are getting naturally adjusted because of the climate, variations in the climate. And sudden rain is there, winter is there. Impact of the heat from the spices will be adjusted. Whereas many countries like US or Europe, extreme cold is there and Ruksha nature is there. They are not familiar with Kadurasam at all. They don't use it traditionally. Our Kadurasas are going back. So that will not be adjusted with the climate. See, the Rutra climate is dominant. That's why they have only 4 rasa. Maduram, Amlam, Lavanam, and then bitter. 4th one is bitter. Kadu, they say hot. Not a taste, it is hot. Heat. Is the understand. So based on the climate, only food habits have been evolved. Different parts of the India also. North, we see that a lot of curd is used, or lassi preparation, which curd with the sugar. With the sugar. It is mentioned in Ashtanga, where curd you cannot use as such continuously. If at all used, you need to use sugar or amalagi, where the amla nature of curd is at. So we are using the food habit. You see in South India, there's gingerly oil. Thailam is widely used. North India, this mustard oil is widely, even in food. Is fit to that climate, because extreme rain and extreme cold is expected, extreme heat is expected. You know that in summer, extreme summer, people switch over to rice in some parts of now, like Gujarat. Wheat is comparatively hotter, so wheat is reduced in summer, rice they are used. And breakfast as such is very sweet, like jalebi, because the temperature goes even up to 50 degrees in summer, very hot summer. So to counter the impact of the heat, you need that much synthesis things in the body. Food habits are changed even based on the season. And you see Kerala, a lot of pickles are used. When you come to a place like Chennai and all, comparatively hotter, normally traditional food, you don't have this variety of pickles. This much of spices also will not be used in Chennai. In general, now you have mixing of population, everything is available everywhere. Go to a traditional family and eat, then you understand. Curd is used where sweet curd, not sour curd. Fresh curd, which is not completely turned into sour. It will be widely used in Chennai. The reason is clear, comparatively is hotter in nature. So you need Snigdha support to counter the Rutra nature coming from the season or the place where we live. When I used to use a lot of Ayurvedic Kashayam, many people who know me clearly understand Ayurvedic Kashayam is widely used in Chennai, but it's not widely used in Kerala. Ayurveda is one Kashayam which is mentioned in the Gana of Samhitas, which is dominant with Snigdha nature and less Ushna, minimum Ushna. Gulgulu and all is Ushna dominant. I rarely use Gulgulu kind of preparations in Chennai. Even without Gulgulu, we can create result, provided you understand that what you are doing. You must have a knowledge of what is a body. In that body, how the disease has happened. In that atmosphere, what you are doing with the medicine or food. Then the entire picture becomes a knowledgeable exercise from the side of the physician. It's not a medicine oriented, it is physician oriented. Shastra is more physician oriented, science is more medicine oriented. Nothing is wrong, that is also good, is also good, provided you know it very clearly. You can give the benefit of this Shastra to a lot of people who are come to you with the disease and all. So I think I just shared my understanding how to take care of this kind of season. Need not be embarrassed with new diseases coming like, Ebola or Corona. We happen to treat a lot of Corona cases because our patients were taking treatment from us. for different diseases. Whenever they got corona, they came to us. So we treated effectively a lot of corona cases without creating any trouble to them. That was possible only because of the clarity in Shastra, which gave us confidence to take up new cases, not getting afraid of the name of the disease. You get H1N1, everybody, people are afraid. Corona, people are afraid. Ebola, people are afraid. New cases you need to expect because your activities, food habits, everything is getting changed. Whenever it is not very healthy to the body, you are vulnerable to new disease, new symptoms. Don't think that it is not told in the books. It's not like that. Whatever patient says, we need to take it in the face value. So they are suffering. So we take it strongly and then try to find out what is the reason for that. There we need to put our own Shastra understanding. And when you are giving a medicine, selecting a medicine, there also our own understanding should be there. It makes you more confident. Stand up to the allegations that turmeric is creating damage to liver or amrita is damaging liver. Now that is what is going on in the YouTube and all. No? Effectively, you are not able to counter because we are not confident in our this thing. Where you use turmeric, you are using it in your rasa or all curries and all turmeric is being used. Nobody is dying with the liver disease. Use it as a medicine, why it is happening? When they say that, you must be able to counter. You cannot use turmeric in all conditions. You must be using it according to Ayurveda, not according to the modern medicine. Just because it contains curcumin, you cannot use everyone. So, Bhumi Amalgi you are using for liver disorder. Not because it contains philandine. It may contain philandine, it's okay. But you are using Bhumi Amalgi because it has got a Pittahara and Lomana property, which is very much required in the jaundiced condition. That is why you are using it. So, entire purpose is this. So, curcumin or amrita or ashwagandha, widely used by other people also, not based on Ayurvedic understanding. It may create a difficulty also. It is not digested. It can create a difficulty properly. So, when you look into body, our problem is that when you look into the Agni, instead of blaming a food or external factor, medicine, 50% external factors can damage, can create trouble to the body. What about internal factors like Agni and all, which could be understood by using the subjective mode of questioning. Objective mode of questioning is there in the science, with which you can understand a lot of things. But your feel of your appetite, your feel in the mind will be understood if you ask some subjective question. So we must understand dosha, dhatu, or all these Agni concepts, Vayu concepts and all are dominantly subjective in nature. You cannot show a physical proof for that. Those who are having a trouble, those who are having the difficulties, they can explain. Normal body, how can you explain that? Why you will be like this? Why you can create this symptom? It can be innumerable. Possibilities can be innumerable. So it is a subjective understanding. Dosha. This is where we fail. Science talks about objective physical proof. Ayurveda talks about physical proof as well as subjective proof. There we lack the clarity, so we don't care for that. If Agni is weak, all diseases are incurable. Veda very clearly says, Nashte Agno. So, if Agni is lost, you are lost, whatever be the disease. So that much importance is Agni. Yoga Sarvevi Mande. all diseases start from Mandagni. So this Manda Agni concept is subjective in nature. Is an added understanding in Ayurveda. Individuals can look into that, or they can verify in their own body. When you say subjective, you can feel it. When you're hungry, what is the feeling? You can experience. So that understanding you need to apply to the patients, where the subjective symptoms are understood in terms of dosha. Accordingly, medicine is selected. Don't think that something is given, my duty is over. No. Knowingly give it, knowingly you create a result. Whether you know it or not, then and there you can cross-check with yourself. If you don't know, you can talk to somebody. Some experienced people you can talk and you can enrich your knowledge. So you must have a knowledge of what is the body. Based on that understanding only, you can say what is a disease. Not based on anatomy solely. Based on your understanding of the body, you understand the disease. Otherwise, what happens? You don't know prameha, you know only diabetes. So you need only medicine which can reduce the sugar level. Rest of things you don't. Pandu, you don't know, you know anemia. So you know only iron drugs, iron-rich drugs. But we say Pandu is a big disease, Mahavir. That we don't understand. So we must have a knowledge of what is the body, how is it functioning, and naturally doshas will be understood. Based on that, you understand what is a disease. Based on these two understanding, you go for a planning, you go for a work on the body of the patient. So the entire exercise becomes knowledgeable. We know that what is a medicine for all diseases, you know. Yaga pratnyaparadhana, indriyopashama smriti, deshakala atma vijnanam, sadvrtasya anvartanam, anulpati samasena vidiresha patastha, nijagantu vikarana, ulpannanam cha shantaye. So what disease is manifested, its cure is based on this, deshakala atma vijnanam, the knowledge about yourself. So when you look inside and try to know whether I know it or not, that is the first question. Whether I understood it or not. If I didn't understand, I need to approach somebody else for a better clarification. And that knowledge is what is working according to Vagbhada, not medicine. That knowledge is working for preventing the diseases, whichever disease manifested, that also can be cured. If you have the knowledge of body, knowledge of disease, knowledge of medicine, knowledge of treatment, that knowledge is working as per Vagbhada. As per Vagbhada or Charaka, whoever talks about it, understand. That's why we say this is Veda, fifth Veda. Veda is knowledge. So knowledge is working, it's not medicine. So knowingly you do a treatment using medicine. Then it creates a result. And ultimately your duty is to create a result. Just give a medicine, there you don't end your effort. Create result. So even if it is not cured, you need to try to understand why it is not cleared. Then you are trying to understand what has happened there, where I have gone wrong. Then I can improvise my understanding. Then I can work further so that the patient is getting the full benefit of Ayurveda. Atanga panga magnana mastalambo bishak. You can lift the patient from that difficult situation. It's a pava, it's a negative atmosphere disease, you know. You need to lift it. Then only becomes a big actual effort by the physician. So his knowledge of Ayurveda based on the Shastra should be that I don't say that you don't teach or you don't learn other science. Any knowledge is fine. Whereas other science, you are having a bigger clarity. That much clarity must be there in Ayurveda also. Then on the field it will be more effective, or rather wherever there is no treatment, no medicine, such conditions also we can look from a different angle. Nowadays it is possible. We can treat effectively to create a wellness to the society at large. With these few words, I conclude my talk. I invite people to have a greater discussion, especially practicing people. I'm ready to answer for that. Okay, sir. Hello.
Thank you, sir.
Yeah.
Thank you, sir, for
Now
a
it
quite
is-
knowledgeable and thought-provoking session. So
Yeah.
now we can move to the queries. Participants, if you have any queries, you can ask.
Yeah, I think if you can just read
Ah.
out the question, it will be more clear.
Yes, sir. Yes, sir.
Everybody can understand.
Okay. One of the question is, sir, kindly share your opinion on Panchakarma therapy in Grishma Ritu in Vada Kafaja Vikaras or Kafavrada Vikaras.
Fine. Question is very general. Anyway, I'll tell you. I mentioned that, see, generally whatever treatment is done for Vata Vyadhi, especially this Kerala Panchakarma, is targeted at Vada Kapha atmosphere. All Snehanam, Swedanam, Vasti, Puichil, whatever you do, Shirodhara, everything is done for Vada and Kapha condition. But we must understand that there are possibilities of Vada coming with the background of Pitta. Like as I told you earlier, diabetic stroke, Pramaha and Vada Vyadhi together, or alcoholic palsy, Madathyam and Vada Vyadhi together. So there should be Pitta atmosphere from which you can have the Vada aggravate. So whenever you induce Snehanam and Swedanam, you must understand what is the background atmosphere first. Background atmosphere also there can be a disease as per Ayurveda, in which dosha domination has to be understood. Because you are treating dosha in the body, background there is a disease that has to be corrected. Same way, in summer, suppose you are doing a Grishma, lot of heat, different parts of India, different grades, you get it. But that impact of heat you have to understand and reduce the medicine whichever is Ushna in nature. Minimum has to be used. Panchakarma also, Svedana, when you are doing, Ushna Tailas can be limited. Ushna dominant Tailas like Kotanchukadi or Panchamla Tailam, lot of Karpuradi Tailam, Ushna dominant. May not be used in summer. Even without that, you can get the impact of it. Karpasa Tailam. These are the thylas in which milk is not there, so you feel it is very hot. So you are calculating the impact of Ushna, whatever you do. Panchakarma, if it is essential, you can do it. If it's Vata way you have to do it. One is the disease background you are looking, where the Ushna impact you have to calculate. Second is the place where he lives. Third is the climate season where the impact of heat is there. And his habit, very spicy, lot of masala, not of non-veg eating people. Body, you have a heating nature, very hot nature. And because of your satmyam, food. So all these conditions, you are just calculating how much heat is there in the body. Then Snehanam, Swedanam, you are doing for Vada. Swedanam is induction of heat. It need not be a steam. It need not be a patra bodla Svedam. If at all you are doing patra bodla Svedam, you can put coconut in it so that the heat can be adjusted. Shashtika Pinda Svedam is with milk rice, heat is minimum. Churna Svedam is very hot in it. You know that medicines used like kolam, kulatham. Kulatham and all is very hot. The Churna Pindasvedam is very Ushna in nature. Should not use it. Even internal medicines, as I told you earlier, you are giving some medicine. Another time you can give something which can reduce impact of heat. But all you think that Gulgulu has to be given. Other time you have Gulgulu also, you get Lakshadi Gulgulu, Chandraprabha Gulgulu, where the Ushna is addressed with other medicine. So Ushna is provoked in the body, in the disease background, in the climate. Whatever you are doing, even if it is Panchakarma, medicines used, including Thailas, you need to ensure that Ushna dominant things are not used or minimized. Then only Panchakarma will be effective. Second thing is that when you do Vasti and all, need not do it 16, 80, 30 and all, no? That's bluntly done. If Agni is there, then only you can go for Vasti. And Agni is subjective, so it's not easily understood. Without Agni going weak, you cannot have any disease. So Agni has to be carefully preserved before doing any kind of Shodhana therapy, Vivechanam, Vamanam or Vasti. Don't think that just doing Vasti, back pain disappears. No. It has to be induced without creating a trouble. Then you need to ensure that Vasti, if you look, you see, you have to create Agni through Sneha, Sveda and all. Then only you can do any Swat. Ama condition for Agni is weak, even a Mukha Lebam is contraindicated. All karmas are contraindicated when Agni is weak. So when we do Vasti, you have to doubly ensure that it is perfectly fit into the atmosphere. Agni is preserved, Agni is created. It doesn't have an atmosphere of weak Agni. Like certain diseases, you know, Arsas, Adisaram, Grihani, or Pandu kind of disease history always come from weak Agni. That's why Arsas, Grihani and all is not fit for Vasti, no? Vasti is contraindicated. So it can further weaken the Agni. Instantly you don't feel anything, but in long term, you are weakening the Koshta further. It may create some other trouble. Fortunately, we don't identify that disease that is that because we don't know Shastra. So actually, you are inducing another disease. Later, maybe 6 months, 1 year later, we take it as a new disease. That's all. So Vasti kind of Shodhana therapy, I have to be careful. One is medicine using for that, based on the dosha background of the patient, disease background of the patient, his habits, food habits, the place where he lives, and the climate in which this treatment has to be done. So when you calculate all these things, definitely you are making it more effective. Whatever you are doing, it is a knowledgeable exercise, you create a result. Fine. I hope I cleared that down.
Oh, okay, sir. So shall we move to the next question?
Yeah.
Merits and demerits of consumption of barley water or barley kani, as per your opinion.
For what purpose? That also should be made clear.
Yeah, the question has been raised by Dr. Uma Sendil.
Yeah.
Can you please ask the question, ma'am?
Hello.
Hello, sir.
Good evening, sir.
Hello. Good evening. Good evening.
Good evening, sir. Sir, this barley water has been very much used in Tamil Nadu in most of the seasons. And anything related to kidney, people don't even consult a doctor. They just right away take barley water or barley kanji.
Diuretic.
Yes, sir. Only for the purpose of diuretic. And they also feel it removes renal calculi. But in Ayurveda, we say it can be taken. It is a nitya ahara like. What is your opinion on this, sir?
Barley can be used because it is leghu. It can be used, and it is Brahmanam also, Snigdha. So
Okay.
it can strengthen the urinary system where urine is naturally produced.
Okay.
So kidney disease or even stone is a vata vyadhi in the urinary system. Stone is not the issue. System has gone weak. Urine is not properly evacuated. Urine gets thicker, concentrated, and stone is specific. So Ayurveda is not directly looking to stone. So you know that Viradharadi Ganam is a medicine widely used for stone. It is a Vadahara Ganam. The Vadahara Ganam. Actually, Vadavari, the treatment is told for Mutra.
Okay.
You are trying to strengthen the urinary system. Where this barley is effective.
Okay.
It is Snigdha, but it is Leghu. So it will be easily accepted. So system is improved. Like Goshram. Goshram is a Legu Panchamulam, no? Vadahara medicine. It's not diuretic. The term is not fit here. It's not increasing the urine. It helps the urinary system to produce urine the normally.
Normal.
The
Sheetam, sir.
system is strengthened. Yeah, it's not Ushna Brahman. It's not Sheetam. It's not Ushna Brahman. So naturally, system is improved, more urine is, whatever is retained will be going out. When urine becomes diluted, stone dissolves in it itself. That's how it happens. And you have medicine which can break the stone, the strong medicines, even Kuladam, fit for that. But it is never indicated as such. Along with Vadahara medicine combination, we need to include. Because our work is not to break the stone alone. You know that it recurs always because stone is broken, again it comes. System weakness is there. So whenever system is weakened, then only we say there is a disease. The urinary system is weakened, you are prone to many conditions. In which our duty is to strengthen that along with the overall health. In that, many things like Gochura or barley, everything strengthen the system. They will be Vadahara drug. Even Hraso Panjamula or Bhadra, Charula, you say. Diuretic. Diuretic is not the right word for that. Diuresis is forced urination.
Forced urination.
Here you are not forcing. You are helping the system to create more. Okay, so barley will be very innocent. It cannot create a trouble. It is very light. At the same time, it strengthens the system.
Okay, sir. Thank you, sir.
Fine.
Okay. Okay, sir. So the next question is about refrigerated food items. Dr. Adityan Krishnan, can you please ask this question? Okay. The question is, hello?
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 Oh, it's audible.
Please.
Sir, I'm here with Dr. Shrivats.
Hello? Namaste.
Srivats.
Please. How are you, sir?
Fine. My question is regarding refrigerated fruits like watermelon. How should we?
I think some problem with the connection. Hello?
Sir, my question.
I think some problem with the net. Impact of refrigerated food you are telling, is that
Yes,
right?
sir. That of refrigerated food like watermelon. And how to discuss these concepts with patients.
Yeah. Fine. I would like to say, what is a refrigerator? Suppose you keep a vegetable or fruit outside the refrigerator, it will be, I think, disintegrated within 1 week time or 4 or 5 days time. To take it like that. If this fruit or vegetable is kept in the refrigerator, it will stay for another 4 or 5 days more, 10 days, 12 days. Then also it will be disintegrated. That's what I say. Impact of Ushna Virya and Shida Virya. Or you say exothermic reaction. Heat is always promoting the natural disintegration. That heat is restricted in refrigerator, but you cannot stop it. Even then it will be degenerate after some time. So any food which is kept in refrigerator, to ensure that to retard the degeneration, you are keeping it. So too much time kept on the refrigerator, definitely it will be degenerated part deep inside, which can damage, which can contribute to the degenerating atmosphere in the body. There is a disease. Second thing, watermelon and all. Watermelon is a summer fruit, you know that is very cold in nature, very shida. So wherever there is less Agni, I say, watermelon can be avoided. You have many other fruits which can be used in summer. Watermelon is very, very cold. So Agni is watermelon is good in summer. That watermelon you are keeping, making it further cold in the refrigerator. This cold Shida nature can suppress the Agni. Your digestion will be reduced, medicines will not be absorbed, food will not be absorbed. It can provoke the dosha. Dosha formation also starts in the Amashana, Kapam Piktam Vata. So that can be disturbed in the disease concern. So whatever you keep in fridge, as such if you are using, you are inducing an extra cold nature to the stomach, which will go against the Agni. Just like in a fire, you put out the fire by sprinkling water, no? So water and fire are opposite. Only Chidavidyam, Atra is Ushna. So you have a Ushna Vidya, Kayo Agni, body is Agni. That Agni you are trying to reduce when you are using something very cold. So extra cooling is not actually told in our book. Naturally cold, you can use it. Night cold and all. Mud pot cold and all. Very much cold actually is not indicated. It can reduce the then different people can have different impact. If you have a cold, that will be aggravated. If you have a loose motion, that will be aggravated. If you have back pain, that will be aggravated. When you don't address Agni, dosha formation also will be disrupted.
So generally, cucumber and watermelon, all those, like you said, are cooling in nature. But during summer, Agni is also less in that time period. So how should we approach this concept?
See, water is very much required in the summer. Why book says Ganga, what is that? Ginger water, jeera water, honey water. You understand, honey is Kadu Vipak. Okay. Kadu Vipaka means in after digestion can support the Agni. Kashayarasam, Kadu Vipaka. Okay. Madhuram is there, Kashayarasam is there, Kadu Vipakam is there. So even if you are giving water which is Shida in nature, you ensure that Agni is not disturbed in summer. Every system is weak, Agni is also weak. You give Snigdha food, but it should not be Guru, it should be Lagu. That's why Laja kind of things, not ghee. Ghee will not be easily accepted. So Guru things need not be there. Lagu things, but Snigdha can be induced in summer. So water also, even water you put ginger. In Kerala practice, you know, Chukuvallam. is there. That practice has come like that. One piece of chukku, dried ginger, you are putting in 1 liter of water. You don't feel hot, but at the same time, it can support that. Jeera is like that. Jeera water is widely used. Houses general, stomach problem. Now, somba and all people use widely. No? So, this is the purpose. You need cooling things, but you ensure that Agni is protected. Both are opposite. Season is very hot, you need cooling things. Very cold fruits are not indicated. Fruits with little amla rasam is good because amla can increase Agni. That is how it is told. So when you are doing something, you understand the medicine, food, whatever it is, and its impact accordingly, we can calculate. And individual to individual, it should change. To this disease, you don't say, this disease to this person, then you are closely monitoring. Not disease-based alone. Disease possibilities are innumerable. Ajim and Anandyam Taratam Yoga. Yoga Dasta. Anandyam, endless, innumerable. So each individual can have disease and its impact in different. So our medicines can be different, it need not be generalized. This is where our research fails. Our research, we are just copying the Western style, trying to find out single medicine. Even they say one antibiotic is not working for all the people. We are still doing research in the same way, trying to generalize things, find out a medicine which can have a result, thinking that medicine contains some chemical which will reduce the disease. This is not the way at all, our thing. We do our work sincerely, there is a result. Whoever is requiring that, they can come and see that. That happens. That happens when you deal with major disease like cancer and can be created. Result can be created. You don't require big medicines. Is that clear? I address? Yeah.
Yes, sir. Very clear.
Okay, sir. The next question by Dr. Sridhar, sir. Can we correlate the word Kleda of Ayurveda with any modern biological fluid?
Kleda is a vitiated form of dhadus. Dhadus are snigdha in nature. I tell you that. Kleda is the normal, unwanted part of excretion when dhadus are transformed. We know that whenever there is a change, science says everything is a chemical change. From one stage to another stage, you are changing. So some part will be excreted as a waste. That's why you say change, transformation. So one dhatu is snigdha. One state is transformed to another state. Some amount of snigdha is given out. That is known as kleda, which is also an essential part in the body. Okay. So you can have a tissue fluid which can be corrupt. That understanding is there now in biochemistry and all. Tissue fluid can be corrupt, turbid. They use the term turbid. And normal tissue fluid, cellular fluid need not be turbid. It can be turbid, then it becomes unwanted atmosphere. Body will try cellulitis and all it happens. Body is trying to push the cellular fluid, which is vitiated. Same thing we say, kleda is a unwanted part of nature. Like when you say cooked rice, you put in water. First day or second day or third day, you see that surrounding that rice, these unwanted things are formed. It starts the disintegration of that rice. So same rice which is healthy gets disintegrated, that snigdha becomes unwanted form. So in body fluid, you can have a corrupt atmosphere, tissue fluid or cellular fluid can have a corrupt atmosphere. Our way is to cleanse it and fill with fresh fluid, fresh jala. We know that ambu yoni, body is water. Origin of life is water. We also say body is water. 70% of body is water. What appears to be hard is prithvi, but inside prithvi it is water. So water can be corrupt. where you need to clean it and again fill it with healthy, pleasant water.
Okay.
Harita ma'am, good evening. Yeah.
Sir. Good evening, sir.
Yes, ma'am. So good evening, sir. Myself, Dr. Sridharan Shetty. I'm just traveling outside, so it was a very informative and excellent session taken by you, sir. And all appreciations to Kerala team. Such a basic fundamental Ayurveda should be taught to each and everybody. So the problem is, sir, why I asked this question? Because till today, like we know Prameha, still discussions are going on. Still, now I am hearing this from my 25 years of post BAMS. Since Prameha, there is now also what you call seminars are going on and workshops are going on to discuss on Prameha. Still, we couldn't find any proper protocol on Prameha Roga. So even All India Institute also of Delhi also they're discussing. So this kleda, like when we see samprapti of mamsascha medascha sharirajamcha kledam is samprapti of Prameha, where it comes to Vasti and from Vasti it goes out. So people are where modern scientists were also there in one workshop. So they were asking kleda is a beautiful word coined by Ayurveda. We don't have equal similar word. Otherwise, if you can explain what is this fluid, otherwise, so we can found it because there is no matching word in modern medicine. Still, urine is there, or sweat is there, something is there. But what is this? Because you have mentioned mutra and mutra and sweda also. So there ends the mutra matter and sweda matter. So what is this kleda? Because urine is urine, but their urine starts from post kidneys, and our urine formation starts from pakvasha, means formation. So there is a little difference. Little means understanding is different. So that was for that reason I have asked this question of kleda. Because you and your students are friends who must have worked on kleda. So how to reduce or something modern wise?
Kleda has to be addressed. That becomes relevant only in Prameha too much. For any Vrana, when it is getting inflamed, kleda is what is getting increased. So kledam is actually a disintegration of snigdha content. Like I explained the rice, boiled rice getting disintegrated. What is coming around it is known as kleda. Klibdyade is disintegrating as a meaning of it. So for dhadus, what is it? All dhadus are snigdha in nature. All dhadus are prithvi and jala. Okay. Then why do you get 7 stages? Everything is prithvi and jala. Why do you get 7 stages? So prithvi, rasa dhadu, you see, snigdha is more and it's in a very raw form. And with the dhatu agni, this is getting purified and you get rakta. That is also snigdha. So each stage with the dhatu agni, you are purifying the snigdha content. And finally, when it becomes sukradhatu, it is not important for volume, it is important for potency. Like matter is containing energy only. But each level transformation, snigdha is getting transformed. So then the difference between 2 stages is that one part of snigdha has to be deleted. That snigdha is kleda and that has to be removed to the urine. So through the body you have this process. Snigdha is getting removed through the urine. When this dhatu agni is completely dependent upon your jadra, you have only one agni actually. Implications we call in different names. So when dhatu agni is weakened, the process of transformation of dhadus also gets weakened. So instead of getting purified, the waste product of snigdha is more and more formed. Kleda is more and more formed. So to remove that, urine has to be more produced, takes it out. So ultimately, if you look at the dhadus, they are getting weakened. That is implication. Kleda is not the implication. Dhadus are getting weaker. Dhadu train, you say Vada Vyadi, you are prone to any disease. It's not stroke alone, any disease. Because structure is 7 dhadus, that is going weak. Dhatu Shayam is known as Vata. That means your body is getting shoshan. Externally, it may not appear, but internally, all Dhadus are weakened. Then you are prone to any kind of aggression from the disease. That is the implication of Prameha. It's not Kleda alone. Kleda is to be removed by urine. Mutrasya Kleda Vahan. And Dhatu transformation is happening all over the body. So since Kleda is excess form, because Dhatu Agni is weak, Jadra Agni is weakened, so transformation is slow. Unwanted Snigdha content is more and more formed. It has to be physiologically removed by the urine. That is work of the urine. So in Prameha, you get polyuria. More urine is produced to remove the Kleda. Still, looking at back to the 7 Dhadus, they are getting weakened, they are getting deprived of the Snigdha content, or in other words, we say Ruksha is coming. So Dhatu Shayam is equal to Vata domination. Then you are prone to any disease, not Vata Vyadhi alone, any disease. That's why it is an important disease. So equal to this kind of thing, I think I happen to talk to many allopathy doctors, especially from US and all. Same question was asked, but they can understand. Harvard people can understand very easily when we say the tissue fluid is corrupt. They can understand. A clear fluid and a corrupt fluid can be understood. Maybe they have to work on that to define how is it. So that understanding is there. May not be in India, I don't know. But I have some few people from the US, doctors, have been talking to me for a long time. I used to take classes also. So they understand this language very clearly. When you make it clear in our own way, they understand. When we try to confuse them with technical terms, they keep quiet. That's all. They know you are not clear. That's all.
Yes, sir. Agreed. Agreed.
Yeah.
Thank you, sir. Thank you so much. I think other people are waiting. Yes, sir. Thank you so much.
Definitely.
Thank you, sir. We'll move to the next question. It has been raised by a second of student.
Okay. From
Jayendra Saraswati Ayurveda College.
Jayendra Saraswati Ayurveda College.
Ayurveda College.
Okay.
The question is, sir, I have to daily eat mess food which consists of dishes which is prominent of Snigdha and Ruksha guna. So what and which extra
There's a problem in the question. Snigdha and Ruksha guna together, they are opposite.
Yeah.
You can specify the food.
Prasad Vidbhai, are you here? Can you ask the question once?
Hello.
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 I'm audible, sir?
Yeah, clear. You can ask.
Sir, actually, we are eating, we have to eat mess food daily. So it consists of a lot of aharas, which is not good for Grishma, sir. Dadhi we are using daily on the daily basis, sir.
Okay, that is there. Fine.
Sir, sir, and I'm from Maharashtra, so I am not Satmam to this heat of Chennai. So last year I suffered of many problems due to heat, sir. So what do we have to take what you have to take measures in Ahara Vihara, extra measures to
I understood.
prevent.
I'm very happy to address you because I was the principal in that college a few years back.
Yes, sir.
Fine, very happy to address you. So what I say is, this is not a problem to you alone. Whoever comes from different parts of country, when you come to new place, you need to gradually adapt to that kind of food because that food is familiar to those people who are staying here. If you go to Maharashtra and all, Maharashtra Bhavan, you have only 2 meals a day, no 3 meals. Maharashtra Bhavan gives only 2 meals. 10 o'clock, 11 o'clock, there is a heavy meal, a lot of dal, lot of ghee, lot of rice, vegetables, and evening 5 o'clock another meal. So that is fit into that climate and it's not wrong. So when you go to a different place, this is why I say the importance of place. Desham. Chennai is almost like Ushara Bhumi as explained in Mahabharata. Ushara Pitta. The heat is more. So anything which can increase the heat has to be carefully used in summer. Even other season also heat is too much. Except December, January, most of season heat is too much in Chennai. So Ushna things have to be careful because Kadu Rasa has to be limited. Kadu is Ushna Rucha. Amlam and Levanam are Ushna Snigdha. Amlam and Levanam can be better than Kadu. That's the meaning. One thing. So curd, if it is fresh curd, sweet curd, it be fit for summer. This is told in Bela Samhita. In kind of Ushna Rucha place, you need to use curd. Except all other conditions, curd can be used, fresh curd can be used. That means it has not completely turned amla. Morning you put lemon in it so that noon you can use it. Basic taste will be little sour and of course snigdha. That can be used. That can resist the heat. Sour curd is not very good. And any side dishes which are spicy nature has to be limited. In between, if you are feeling hungry, you need to depend on fruit, except mango, papaya. Mango, papaya are heating. Further, other fruits can be used as a food in between the main food. Just avoid any kind of junk or other dishes you get from the bakery and all. You make it fruits. If you feel very hungry, you can have juice. If hunger is not very good enough, you need to go for fruits, not juice. Juice, you'll be taking too much of fruit inside, and you should have enough hunger, agni. Otherwise, it will not work. So summer, more water, buttermilk will be good, fruits will be good, more liquid should go, food should be light, less ghee and all, less spicy, no pickles and all. Curd, if it is fresh, you can use it, otherwise leave it. Very spicy things you need to leave. Right? It's very difficult to address all variety of students when they come from different parts. Nobody will say this food is good. One person will say this is good, other will say it's very bad. Because you have the variety in India. Everywhere it is based on a climate people are making it. This is what is known as culture, tradition. That cannot be wrong. Thing is that when you go to a new place, you need to gradually get adapted. This is what is known as satmin. Even to a poison, you can be accommodated gradually, Vishwa satmin. So food, you need to be careful. Most important thing is that you look at the food, whatever is fit for you, you can use it. You look at your stomach also. How far I am healthy in stomach. Based on that only you can select things. That also can trouble you if you are not just looking at the food alone, not looking at your agni. I think even a normal food sometimes can trouble. So summer, you remember that it is a heat which can weaken you. Fruits will be the best option. More liquids like buttermilk or like juices. In fruits also you have Ushna things, mango, papaya kind of thing. That should be limited. Pickles should be fully avoided in Chennai. That's what I feel. And need not fill the stomach also. Even normally, that half of the stomach should be filled. That is our way. So need not fill the stomach. Fill it with water in little gap so that stomach can accommodate. And 1 or 2 months, if you cross, I think it will be fine without difficulty.
Okay, sir.
Okay,
next
thank you, sir.
Okay, thank you, sir. So we'll move to the next question by Dr. Radhakrishnan, sir. What can we do to prevent gouty arthritis? Especially more cases are there in this season.
Okay. Gouty arthritis, I think when I was a student in Kottakkal, we had this seminar of differential diagnosis of rheumatoid, Vadaraktam, Amavadam, and Sandhigata. When I was a teacher in Coimbatore, I conducted a seminar on the same topic. When I was a teacher in Chennai, I was a moderator for the same topic. In research, Coimbatore, I think I happened to be a paper person at that time. The topic was almost same. Still, people, I think, are not very clear about what is rheumatoid, what is gouty arthritis, what is rheumatic fever, what is osteoarthritis. Lot of confusion. So, but I used to say that Vadaraktam is a condition in which degeneration of the structure is the main symptom. Vada is the maximum weakness. When Rakta is vitiated, that weak structure can be degenerated. This is Vadaraktam. Disease process starts from Jora to Vadavyadi. Vadavyadi is your body is maximum weak to the core, to the deepest part. So Jora to Vadavyadi is the process. Beyond that, you can have weakness plus degeneration, nothing else. So including cancer, metastasis, everything can come under this category, degenerative nature. So rheumatoid arthritis is one in which degeneration of joint is the main issue. And in that again, gout arthritis. Gouty arthritis is another joint which is more confined to one joint and all, but degeneration is more acute. Symptoms are more acute. So I used to say that Pitta dominant Vadarakta can be treated as gouty arthritis. That's why in Ushna season it can come up easily. Whose body is very hot, whose practices are heat generating, who is having background disease in which heat is there, who is living in a hot atmosphere without caring for food habits and all, can easily have a gouty arthritis. You understand, gouty arthritis people cannot have protein-rich food, even dal. Dal is heating, dal is provoking pitta, and its implication is that uric acid can damage kidney, can degenerate kidney. This is what we are telling. Degeneration comes when your structure is weak and blood is vitiated. Blood has to regenerate. Normally, when it is vitiated, it can degenerate. This is Vadarakta. So very carefully, you have to induce medicines, a little Shida things without provoking Vayu, you need to do it. The Shamula Dara you can do with for Vadvyadi, Sandhigata Vatam. It is gouty arthritis, you do it, the Shamula Dara with milk. Shida medicines cannot be given. Kogilasham can be given where it is Anushna Shida. It creates Rekta Shuddhi, like Ashoga. It's not Shida. Shida can provoke Vayu, pain can be increased. So you have Rekta Shuddhikara medicines like even Shadavari, not very cold. Shadavari Adi Kashayam is there. Kogilasham Kashayam is there, which can gradually reduce the Ushna impact of Rekta. It will not provoke Vayu also. Shadangam Kashayam is there, in which Amrita is 50% Amrita is added, the rest of the medicine are taken. Such medicines can be induced. Shadavari Adi Kashayam is there. Shadavari Chinniruha alone Kashayam is also available. So such medicines on long term, you ensure that the heat impact is reduced. Food, you need to address them, tell them not to take anything Ushna in nature. Then activities, especially mental activities in which agitated, frustrated, anger feel is there, which can provoke pitta, should be reduced. Then in food, all dals, all protein-rich things, you know, it becomes amino acid later. So pitta provoking, that cannot be main food. Rice is main food, supplementary is dal, protein-rich things. So it should be very much limited. They say no dal at all. Even the seeds of what is it, beans and all can provoke it. So I think it should be limited. Pitta atmosphere has to be addressed without provoking Vaya. Pitta Rakta has to be addressed. As we have a lot of options on that. Mind also, Ayurveda people has to take care because Pitta and Vada can come through the mind as well. So that is not discussed with the patients. I think that part also can be pacified gradually. Not an easy thing, can be pacified. These all are added advantage for the Ayurvedic system. They look only for blood test and all. We can address from different plane also. Okay.
Okay, sir. The next question is, what is the specific indication for giving Shadanga Paniyam in summer? Can it be given to all the age groups in general? Sir, please explain.
Generally, it can be good for summer. I think in Kerala, even waters, they give some that rose water, no? Ushira is added, or Patmakam is added, or Chandanam is added. Anything which is cooling, Daha Shamanam, Pitta Shamanam is added in water and heated water. That is, nowadays you get a lot of Daha Shamani. All companies make Daha Shamani combination, which has come from Shadanga mode. Ushira Parpadodicha Mustanagara Chandana. Everything very little. Drinking water, I think it should be minimum. It is not Kashaya. In disease, you can make it Kashaya. Drinking purpose, you need very little powder. Boil in water. It Daha Shamanam, it is thirst quenching is there, plus Ushna can be addressed. It can be given for all the people, provided there is no other disease. Pitta dominant disease, you can use it. Pitta atmosphere, you can use it. Summer, you can use it. If there is any other disease, this may not be good. For example, Adisaram is there. It may not be very good. It will reduce the Agni further. Like that, if there is no other disease, it can be suggested for even normal people. Kana Chandana Shundyambu Parpado Shira Salva. Shira Parpado Dicha Musta Nagara Chandana as per Sharam Darasmi. Same combination. Instead of Chandanam only, we use Amrita 50% and give it in Vadaretta. Understand? Chandanam is removed, Chandanam can provoke Vayu. Instead of Chandanam, rest of the 50%, and 50% you can add Amrita, Vadasravoge, Guduji, and it can be used in Vadaretta condition. Even in gout arthritis also, I think it can be used.
Okay. Sir, the next question is, what to eat in summer for a Vata Pitta Prarudi person? Vata Pitta Prarudi person.
A very big question because, Prakriti is wrongly understood. You don't have to adjust to Prakriti because you cannot change it throughout your life. And why should you adjust? Disease, Vikriti, disease, atmosphere, and all you need to address. Prakriti, you cannot address. There's no point in that. It is just like, snake carrying antivenom. Why should a snake carry antivenom? If you have Vada with the Prakriti, which is among the Prakritis, which is very bad, very weak, physically, mentally weak. So that kind of atmosphere is not going to disturb you, or it's not going to change. And any disease is an effort to change it. Any disease is an effort to going towards that. So that is what is known as actually Prakriti, Shayaneva Vishakrame. Janma this. From Janma till death, it will be there, whatever you do. So you don't have to counter that based on Prakriti. Based on Vikriti, diseases, other health conditions you need to address in summer and all. So understanding of Prakriti, if you very carefully read, you understand. Prakriti Nama Swabhavayam. This is your Swabhava. You can't change it. Your basic character in the physical plane, mental plane, and spiritual plane. When you change it, you are no more. You are a different person. Your body will change, everything changes. All diseases are trying to kill the Prakriti. That's why you call it as the Vikriti. So Prakriti you need to address. Everybody has got all the three doshas. As I told in the beginning, gross structure is Kapha, subtle part is Pitta, most subtle is Vata. It is there for everybody, so everybody will have Vata, Pitta, Kapha. Nature by nature, proportions can change. That's all. But based on Prakriti, you cannot adjust. Vata Prakriti cannot take hot, cold water. No, it's not like that. Vata Vyadi, you need to do it. Vata Prakriti, if you are taking cold water, nothing is good. Just like anybody else, you can have Vata too much easily. That's all. Fine.
Okay, sir. So now we come to the end of questions, sir.
Yeah.
So it's a quite informative session. We got many thought-provoking questions and more clarity of concepts from you, sir. Thank you so much, sir. So now I welcome Dr. Krishna Kumarji, State President, Vishwa Ayurveda Parishad, Kerala, to share a few words about the webinar. Welcome, sir.
Please.
Namaste, sir.
Namaste.
Namaste, namaste to all participants who attended this webinar. Sir, this is it is a very, what you call, it's a very informative and knowledgeable session you have taken. I think learning does not end at any point of time. It continues till our last breath. I think like that. So this definitely might have helped all the participants to ignite the basic concepts of Ayurveda. So we have learned, and we have means I am now 64 years of age. So long years back, I have learned these basic concepts. Normally, we have the habit of not reading the books regularly, almost, except I think except the persons in academics, most of the Ayurvedic people do not have that nature, that habit of reading the books regularly. So this might have definitely helped people like me to refresh what you have learned earlier. So this is I appreciate, I congratulate and appreciate you, sir, very much, because you have gone deep into the basic concepts of Ayurveda. So I request you, sir, again and again, that please share some more time in future in subjects like this. I thank our Vishwa Ayurveda Parishad people who have come forward to engage you, invite you, sir. I thank them also. I thank you very much, sir. Once again, I thank you very much.
Definitely.
Thank you so much, sir. So now I welcome Dr. Radhakrishnan, sir, State President, Arogya Bharati, to share a few words with us. Welcome, sir.
Namaste to all. I am in traveling. I am waiting for train in Vijayawada stations that I cannot speak more.
Okay.
I am not sure whether Dr. JAYAKRISHNan ji remembering me or not. I was working with him for a short time in Coimbatore Ayurveda College. And anyhow, it's a very nice presentation, as well as it will enrich our knowledge. So I'm very thankful to you, as well as I appreciate the team behind this program. I must congratulate Dr. Adarsh C. Ravi, the General Secretary, as well as the other people like Dr. Pavan, Dr. Harida, Dr. Amal, and our respectful Dr. G.P. Krishnamurthy, and the team leader, Dr. Dinesh, everyone, and Dr. Arun Lal. So I am not in a position to speak more. Thank you for giving me an occasion to congratulate you. Thank you.
Thank you so much, sir. Sir, in chat box, sir, kindly share your number so that all will be benefited.
My number.
There is one, sir.
You can note down. I'll tell you. 93810.
I'll put in chat box. 93810.
93810 25721.
25721.
Yeah.
Okay. Thank you, sir. So now to deliver the vote of thanks, I wholeheartedly welcome Dr. Dinesh Kumar, sir, State Treasurer, Vishwa Ayurveda Parishad, Kerala. Welcome, sir.
Hello.
Yes, sir. You're audible.
Namaste to all. Yeah, namaste to all. Namaste to Dr. JAYAKRISHNAN and all the national leaders of Vishwa Ayurveda Parishad, like Dr. Vinodji, Dr. Surendra Chaudharyji, Dr. Anish Shetty, and all the participants of this program, and also to the Vishwa Ayurveda Parishad members. Now it's around 9:50 and we are running short of time. So I'm not extending my time and not taking too much of time for this vote of thanks. On behalf of the Vishwa Ayurveda Parishad Kerala, I extend my sincere gratitude to Dr. JAYAKRISHNAN for sparing his valuable time and knowledge to people like me and the youngsters to give more input on the basics of Ayurveda. Truly, it was a wonderful session, very knowledgeable and refreshing one also for people like me, just like Krishnamurthy so told, and who are practicing Ayurveda without reading many of the Ayurveda books. Anyway, it has thrown a light upon me also to read the textbooks frequently and to attend the programs like this. I hope the younger generation will be benefited by this program very much, which will give them more confidence in the future years of Ayurveda, where they will be the torchbearers of Ayurveda in the future. I extend my sincere gratitude to Dr. JAYAKRISHNAN on behalf of Vishwa Ayurveda Parishad Kerala. And also, I extend my sincere gratitude to all the participants who have attended this program, to the national leaders of Vishwa Ayurveda Parishad and to Vishwa Ayurveda Parishad members and all the participants in this program. And I hope I have cleared all of them. Thank you very much, sir, for sharing your time once again. Thank you to all. Thank you.
Thank you.
Thank you so much, sir. So hereby we come to the end of today's webinar. So thank you all the respected dignitaries and participants, expecting your cooperation in the further webinars also. Thank you, Anand.
Namaste, namaste.
Namaste to all. Namaste.
Dr. Harita ji.
Yes, sir.
Good job, very good job. And I think you can stop recording this now.